Thank you, Samantha. Thank you, everybody, for coming today. Ticks. Ticks is a big, big issue, and I put this slide here to start with for a good reason. How do we prevent tick bites? And as you can see, this is just a snapshot of what ticks can do to us. 31 million people are thought to be bitten by a tick in any given year. And this number is actually going up over the last several years. Out of these people, about 476,000 end up being treated for Lyme disease. It's a huge number. And it's a huge number, and all of this can be prevented. It can be prevented how? By preventing the tick bites. And sometimes we dismiss ticks by like being tiny little critters. If you think about it, if you get bitten by a spider, it hurts. You would know right away. If you would get bitten by a bee or a wasp, again, it hurts. You know right away. You get a welt, and you're going to know there is trouble. But if you get bitten by a tick, tick bites don't hurt. Ticks can be small, and that makes them dangerous because these events occur without us necessarily knowing. Can I have the next slide, please? This is just a slide to depict the incidence of Lyme disease, which correlates with the incidence of tick bites in the country. And as you can see, Long Island is colored dark brown. It's in a high incidence place. So the Northeast with New York State, Pennsylvania, Massachusetts, Connecticut, and a couple of states in the upper Midwest, this is where these tick bites occur. So we do live in a beautiful area. We live in an island with nice seashores, with nature and everything. But it comes, unfortunately, at a price because we also have a lot of ticks. Can I have the next slide, please? This is just showing that over the last couple of years, the incidence of Lyme disease specifically has increased and continues to increase. This light blue line is actually New York State. So the number of illness reported in New York State has increased dramatically. Next slide, please. So this is probably the most important slide you have to remember. These are the ticks. The ticks that can carry not only Lyme disease, but 4 different tick-related diseases. Lyme is the most important one that people know. Then you have Babesia, then you have Ehrlichia, then you have Anaplasma, and then you also have Rocky Mountain spotted fever. So it's more than just Lyme behind these ticks. And the 5th issue is the so-called red meat tick-related allergy, the so-called alpha-gal syndrome, which we can talk about it a little bit more as well. So these ticks projected here look huge. The reality is these ticks are very, very small. The dog ticks, the deer ticks, and the Lone Star tick. Can I have the next slide, please? I put this slide so you can see on the right upper corner, there's a magnified dime. This is a relative size of how the ticks look like. For example, for the black-legged tick, the larva is very, very, very tiny, very easy to miss. And you can be bitten by any of those, the adult female, the adult male, the nymph, or the larva. All of those can carry the disease. And it cannot be only just Lyme. As I said, it can be Babesia, it can be Anaplasma, it can be Ehrlichia, it can be Rocky Mountain spotted fever. All these illnesses that are carried by ticks. Now in the middle, the lone star tick. As you see, the first one on the left has a little white dot. That's why it's called Lone Star. And this is the one associated with alpha-gal syndrome, the red meat type of allergy syndrome. So these ticks being so tiny, these ticks biting us and not causing pain or not causing an initial issue can be missed. You can be bitten by a tick. The tick usually stays attached for about 24, 48 hours until he gets his blood meal, and then it drops. And you can never know you were bitten until maybe later on when issues start and you get sick with one disease or another. So how do we prevent these bites? First, one has to be aware they can occur. So if you go out, walk in wherever there is grass, walk in a forest, go to a walk in Comset Park, for example, or in Sunken Meadow. At the end of the day, you have to do what's called a tick check. Basically, you undress and you look at your skin, best with a significant other, to be able to look at the area of your body where you can't see, and look very, very closely. If you have a more like a poor eyesight, then better put your glasses on, or even better if you can't see well, a magnifying glass, because these ticks are tiny, and that's how you're going to know. Taking a shower, for example, may not actually remove the tick. These ticks are sturdy. They get embedded, and you take a shower, you think you're kind of washed off. You may not, because they may be hidden in areas of the body that you don't necessarily see well, including on the scalp. You can have Lyme from there as well. Can I have the next slide, please? So this is sort of, again, a magnifying image of a tick on the skin. We see the head of the tick is actually embedded inside your skin. You see the body, and it's going to stay like this for about 24, 48 hours before it releases. So if you find something like this, what do? You get a tweezers, tiny little tweezers, grab the tick from the sides like this, and try to remove it, kind of lift it up, with the care to get the head that is all in there, to remove the head as well, to remove the entire tick. And take this tick and put it in a little jar or a little bag, because you're going to have to take that tick to somebody who knows how to identify these ticks. Your primary care physician may know that, or an urgent care center may know that, to really figure out the tick you found. Is it one of those three kind of ticks? Is it a Lyme type of carrying tick, or else, to know what to do. Next slide, please. So these are a couple of little symptoms that one can get from Lyme disease. I put in here. The agent of Lyme disease is called Borrelia burgdorferi. It's a spirochete, and that gets injected in your body once the tick attaches, and it can cause a variety of symptoms, most commonly the rash. I'm going to show you a little picture of that rash in a minute. And then it can cause other symptoms if the disease is undiagnosed and untreated, including neurological, cardiac, and musculoskeletal symptoms. So that's why the classification shows as well. Early localized, that's the best time to diagnose Lyme disease. You do not want to get into disseminated, and obviously you don't want to get into late. But these things can happen if the tick is not found and the incident is not found. Next slide, please. I put the slide here just to show you how the rash looks like. This is sort of the typical rash on the right upper part of the slide. It's called a bullseye rash. And it's actually a big rash. You have the bite in the middle where the tick attaches, and it kind of grows over a couple of days. And as you can see, it's not that impressive, meaning you can see it, but it can be quite faint. It's not a deep red one. It's more like a pink one. And it, most importantly, doesn't hurt. Doesn't hurt. If you have it on your back and you don't look, you're not going to see it. And it does last for 3, 4, 5 days, and it disappears. Without treatment, it disappears. Doesn't mean you're cured. No, it means that the Lyme actually progressed and disseminated. And sometimes this rash doesn't even occur. Talking about the other kind of illnesses, like the Borrelia, like the Anaplasma, like the Babesia, like Rocky Mountain spotted fevers, those type of illnesses carried by ticks may or may not cause rashes. They definitely don't have a bullseye rash. Only Lyme disease has a bullseye rash. They show up with fever, they show up with weakness, they show up with fatigue, they show up with joint aches. So they're very nondescript symptoms, because a lot of diseases can cause this. So if you don't think that it could have been a tick bite, you can definitely miss the diagnosis. And they have treatments too. One can give specific antibiotics and get treated and get well. Now, what do you do if you find a tick? As I showed you the picture, you found the tick, you know that you may have had it for a little while. What do you do then? You take it to a doctor, and the doctor will look at the tick. And if it's a Lyme-carrying tick, you can get a type of medication, usually doxycycline, that you can prevent disease from happening. But for this to be effective, you have to be fast. In other words, you have to act within the first 72 hours. So if it's a tick bite that occurred within the last 72 hours, you can prophylax with 1 dose of an antibiotic. So you avoid taking antibiotics for a more prolonged period of time. So it's important to check for ticks and to see the doctor right away to get your antibiotic prophylaxis, and then you're going to be safe for Lyme and also for some of the other ones that diseases I talked about. There's a new kid on the block. Alpha-gal syndrome, red meat allergy. What is that? That in itself is not an infectious disease. It's an allergic reaction that our body developed from this lone star tick saliva. That saliva contains a certain protein, or actually a certain glucose, that certain people develop antibodies that cross-react with red meat. What I mean red meat is veal, pork, mammal's meat. And whenever you eat some meat, you develop an allergic reaction. Fever, rashes, weakness, nausea, vomiting, and you figure out why. Well, it could be from a tick bite. So that's another issue that occurred over the last couple of years with this new kind of illness. So another good reason to avoid tick bites. So what do we do about that? You can eat fish and chicken. There's no cross-reaction with that, but red meat is an issue, and it can last for some time. And there's no real good treatment for it either. And that's it.